Thank you for that question about addiction. My professional life, my professional life, in my professional life, I had the opportunity to work with the drug users, injecting drug users in Manipur. I was senior research officer and project director of a behavioral intervention to look at the HIV vulnerability among the indigenous population or ethnic minority population in Manipur, where the ethnic conflict is going on right now. And when I look at the media issues in Kerala, now recently I have been told that I look at it, what are the substance caught by the customs department or the excise department, and we can hear about a lot of time there will be reference about MDMA. Because in Kerala that the discourse is that the Kerala substance use scenario is extensively changed. Now youngsters are using some of the substance use like MDMA. But in Australia, MDMA could be prescribed. You can buy from a prescription. With a prescription, you can get MDMA. So how do you deal with substance use has got a lot of implication. And this is, I would say, one of the major issues. For example, if you look at the substance abuse in Kerala, I don't know how many of you know that injection drug use is still prevalent in Calicut. And Calicut is the only city where there is an active injection drug use prevention program is continuing in a city like Calicut. So this is also to say that the substance abuse related issues are mostly underground, or maybe it's not actively coming into forefront unless there is a raid by the excise department. But at the same time, what we look at is that the capacity for rehabilitation facilities. And if you look at the legal mind-altering substances like alcohol, Kerala is also one of a serious alcohol abuse situation in Kerala. But at the same time, alcohol abuse rehabilitation centers are very few. So anyway, whichever way we look at substance abuse, number one, how that is defined, how that access is controlled, what are the regulatory framework, this all matters. And at the same time, the most important thing is that what kind of support services are there, and how do you reduce the stigma associated with the drug users. And drug users and drug peddlers, there are two different categories. Mixing them together is sometimes it may not give the right solution, or it may not be the right way to explain it. And I would link this with my earlier presentation that I mentioned the social workers' capacity to analyze the social context or social factors, social forces which is contributing towards substance use. Many people say it's as a coping mechanism, it's as a fashion, and also it's a kind of you're experimenting with life. There are many excuses are there, but are there anything beyond that? See, for example, injection drug users in Calicut, what is their relationship with the injection drug users in Mumbai? And why in certain time there's a transition, they move to Mumbai to Calicut, vice versa. So these are some of the social factors which is acting behind the substance use phenomena in Kerala. And also remember that substance use and drug promotion is a job opportunity, quote unquote. It's not a legitimate job opportunity. But remember, when there is in a society where there are limited opportunity for accumulating wealth, they look at various opportunities. And remember, accumulating wealth, pushing drugs is one of the major contributing factor, one of the easy solution for that. And I'll just end with a case study, a story which some of you may not know that. And I don't know if some of you heard about an airline called Cathay Pacific. Cathay Pacific is one of the leading airline in the world. And the Cathay Pacific's first aircraft is called Betsy. And the Betsy was a cargo plane. And the first cargo plane the route was Calcutta to Kunming. Kunming is the Chinese city. And that is the regular route of the cargo plane, the Betsy's cargo route. But imagine what was the cargo content of that plane. that is Patna opium. And the story doesn't end there. The major financing company, bank of this Cathay Pacific, was that time called a bank called Indian Mercantile Bank. And Indian Mercantile Bank later on become HSBC. Why I said this particular example is that in many societies, drug smuggling is an easy way of accumulating wealth. So you should understand that who is using drug promotion or illegal accumulation of substance and the distribution as a means of wealth accumulation, not necessarily using drugs. So this is the political economy of drugs. So maybe as a social work point of view, you may have to have a little more serious analysis of the political economy of drug use in Kerala. Most of our discussion it's looked as a law and order situation. It is more than law and order situation. It is more than a disciplinary issue. It is more than a youngster's transition issue. Social workers can play a very active role in analyzing the social determinants of substance abuse. What factors propel youngsters to use drugs? Thank you. I just give an overview about it. Thank you very much.